But at the end of their presentation, they had a line out the door of people waiting to talk to them, and none of the other three companies did. And I know exactly why the other three companies didn't, because I sat and listened to all four company presentations.
Your business's success depends on relationships with customers, relationships with employees, and relationships with stakeholders. What do they all have in common? They're all human. Because no matter if your business is B2B or B2C, it's really H to H, human to human. Welcome to the Human Connection Podcast. I'm your host, Karl Pontau. Each week I'll bring you stories, insights, and practical advice from experts that you can apply to your growing company and daily life. This week I'm super excited to connect with Suzy Engwall. Suzy is the CEO and founder of Health Tech Strategies, a boutique consulting firm. She also serves as the fractional VP of partnerships at LSI. She is a healthcare innovation leader, speaker, and startup advisor that has been working to change healthcare for almost 2 decades. In her current roles, Suzy works with teams from multiple areas within the healthcare innovation ecosystem, including startups, hospitals, healthcare organizations, strategics, and investors. She strives to work equally with key stakeholders in the medtech community to help amplify visibility of needed technologies and activate investment and market adoption. Previous roles include VP of Early MedTech Development at Alira Health and Executive Director at the Innovation Institute. She is a graduate of Arizona State University, where she earned a Bachelor of Science degree in Health Entrepreneurship and Innovation from the Edson School of Nursing and Health Innovation, where she also is on the alumni board member. Congrats on amplifying the visibility of needed technologies, and welcome to the Human Connection Podcast.
Thank you so much. I'm so excited to be here with you today. Master storyteller. You're doing one of my favorite things. So thank you so much for having me.
Awesome. No, thank you so much for the kind words. So what are some of the big challenges startups face after transitioning from fundraising to post-commercialization? Because I imagine that's a huge paradigm shift that they're probably not aware of or really ready for when it happens.
Yeah, that's a really great question to kind of start off with. And there's so many places we could take this discussion. But honestly, I've been working with startups, mostly in the medtech space, but in the, health space for quite some time now. And one of the biggest challenges I see is that, startups, when they kind of get their head down into this whole fundraising, capital raise thing, and you're always raising money. Even once you're on market, you're always raising money. But the story that you tell to an investor and the story that you tell to the humans that actually have to use your product once it's on the market are two completely different stories. And I see one of the big things, one of the big hills that they kind of have to overcome, or hills they have to climb, is how do they tell their story in a new way? They've always got to keep sort of that capital raise hat on one side, but your quote unquote pitch deck or the story that you're telling needs to be really completely different and have that human touch and that human element involved in it. And a lot of times I just don't see them transition to that. So they'll start doing marketing, and their marketing message is the same message they were conveying to investors. It's a completely different audience and a completely different way that you need to sell your product. So it's a huge challenge, and hopefully we can talk about that a little bit today and maybe give some people some ways to overcome it. I don't know.
Yeah, absolutely. It's something that I think even when they get into the pitch deck storytelling, they often make the mistake of not thinking about what their audience is going to care about or what resonates with the audience. In
exactly.
This case, an investor, a VC firm, or what have you. And so the same thing that they struggle with at that stage, they need to go back to that initial step of, okay, what does our audience really care about? And 9 times out of 10, it's not going to be the same things that you are excited about with your product or your technology. and especially even if I know a lot of go-to-market strategies, like let's get a bunch of users for our app or our technology and then take it to a provider. Well, again, the same problem exists where the messaging that got you all those users is not going to sway an executive at a hospital because they have 1,000 things on their mind, and none of them are another startup that's trying to sell their tech or showing a white paper. So why do you think, or what is something you do to help companies overcome this kind of lack of understanding of what their audience wants?
Yeah, and I think, as a practitioner of human-centered design, I think thinking about your customer should be the way that you do everything in your business. So from marketing to how you build your product. So a lot of startups that I work with will use kind of these human-centered design principles to focus on what is it that our customer wants out of this product. But then when they start thinking about their marketing or how they position themselves when they're in the market, that kind of goes out the window. And I see a lot of startup founders, especially, high tech folks, they get really geeked out and excited about their technology. And I do too. I'm right there with them. I want to know how this AI engine behind what you're doing works, or whatever the technology is behind what it is that you're doing works. But, the person who's the end user for your product, or that actually has to make the purchase of your product, they just want to know how it's going to make a difference in their lives. What are you doing to solve the problem? How do you boil it down to something that truly makes sense? So when I look at a startup and they're talking to a hospital, or they're talking to a hospital administrator, and they start going into this, 10-hour dissertation about how great their algorithms are, the leadership team there doesn't care. They care that you are HIPAA compliant and all that other great stuff. Yes, we get that. But from the get-go, how do we pull them in and make them understand that what you're going to bring to the table is going to change the lives of the patients that you serve, going to make their length of stay shorter, going to make them heal faster, going to make them, happier with the service that they're getting from the hospital? How's it going to make the lives of the providers, the nurses, the physicians, clinicians any better? Or is it? How is it going to integrate into their workflow? So there's a lot of different key messages that you have to give back to these hospitals. But honestly, it all boils down to one thing. It's exactly what you're doing here on this podcast, that human to human connection. And how do you put your product in front of someone and make them think, wow, this could be my loved one. This could be my child. This could be my mom. This could be my dad. And boy, if this was one of them, I better have this product. That is what you want to convey to them, that this product needs to be in their orbit, needs to be in their ecosystem, needs to be something that they're using to make these patient lives better, or to change the way things work in healthcare. We all know healthcare is antiquated, so not every product may be patient-facing. It may be something for physicians or clinicians or even leadership teams to use. But telling the story about how you're going to make someone's life better is a really, really good way to start. And you should be able to do that in less than a minute. So if someone asks you today, what is it that your startup does that makes a difference? You should be able to answer that in 30 to 60 seconds easily. And if you can't, then you better start practicing now.
Yeah, so I'd love to, I'm sure you have tons to pick from, but do you have like a particular example of a time where you worked with a company that was struggling with this sort of thing, and how you helped them achieve that result of explaining their value in like 60 seconds and what it did for the business?
I don't want to call anybody out by name, especially if I'm gonna talk badly about them. But maybe I can talk about some positive stories that I've seen.
It was a positive impact. Yeah.
So one of the clients that I work with, they're called Comwave. They have an AI engine that basically goes in and sits in between all of these noisy machines and helps to stop these unactionable alarms. And there's a lot of great tech behind it, and I could tell you all kinds of stories behind it. But they do a really good job of conveying two things. We're going to make your patient's life better, and we're going to make your staff life better. Your staff is running around back and forth, responding to these non-actionable alarms. Then when there is one that actually is actionable, it causes a huge problem because maybe they're ignoring it, or maybe there's something else going on. But patients are trying to sleep and they can't sleep because these noises go off and on all night. That's the story that people want to hear. I had a family member that was hospitalized for almost 3 months at one point, and the machines, just when I was there visiting, would make me crazy. I can't imagine trying to sleep through a night with this. So they do a really good job of painting the picture about what it is that they do and how they make their patient lives easier. But then when you get down into the kind of the weeds of it, you learn that there's so many additional great benefits for it that can really benefit a hospital, to help with things like nurse attrition, but to also, some of the results we're seeing are showing how this technology is actually making these actionable alarms more relevant and actually speeding up time to care. So they've done a really great job of painting their story. There's another company that I won't give the name of, back from 3 or 4 years ago, that did a really, really great job of storytelling and got all kinds of market adoption and all kinds of money thrown at it. But their tech didn't really do what it was supposed to do. And that one failed miserably. So you also don't want to oversell yourself. You want to speak to your technology in the way that it actually works. But there's good and bad to be able to being a great storyteller. But I think as long as you're honest and open about what it is that your technology does, then you can make really good progress. But it is hard. It's a really hard thing to do. I see companies all the time that are, putting posts on LinkedIn that are like, our technology did, and then like 3 seconds into it, I'm like, I don't even know what you're talking about. I'm moving on. I think another good example is I was at an event a couple of years ago, and I had a client there, and they were one of 4 companies chosen out of a few hundred to present at this event. And at the end of the presentations, I was so proud of the company that I was there with, and they did this without my help. But at the end of their presentation, they had a line out the door of people waiting to talk to them, and none of the other 3 companies did. And I know exactly why the other 3 companies didn't, because I sat and listened to all 4 company presentations, and the first 3, I still to this day have no idea what they do. So it was a lot of gobbledygook about the science and about in vitro, in vivo, and their clinical trials and everything else. And it was all great, but I still don't know what they do, and I don't know how it's benefiting patients. So I think you start to get lost in the science, and what happens is you come out the other side and everyone's like, wow, it sounds really impressive. You sound like you're really smart and have a lot of great technology, but I can't invest in you because I don't know what you do, or I can't buy you because I don't know what you do. So how do you really frame that story in a way that's going to make sense? I don't know if that was a good example, a couple of good examples or not, but
it was great. So from the first one about the non-actionable alarms, as someone who spent 2 weeks in an ICU recovering from a biopsy surgery for 2 brain tumors, and how I remember how terrible I slept those 2 weeks, because all the noises and all the little like beeps and like hums and stuff that would go off, and you're like, what is that? And no one would come and check on it because there's nothing they can do about it. So I when you immediately said it stops those, that makes it quieter, and I was like, oh my gosh, I'm already sold. I'm not even in a place to buy it, but like I want that. Like, why didn't that exist when I was like over 20 years ago? But like that sort of thing, immediately I can see, oh my gosh, if I could have slept better those 2 weeks, I'd have been like so much happier and less like grumpy and just also the whole thing about nurses and like the staff respond better to the ones that's like your technology is no longer crying wolf every time.
Exactly.
That's going to be when something does go off, then they know, oh my gosh, this is a real thing. I need to go work on it. And that's such a genius technology that if they went all into on like, here's how the AI learns how to do that, it's like, who cares? But if you go, hey, here's all the real world impact it has for patients and your provider and like the staff, and that's genius. And I can totally see how any facility that has inpatient or like those sort of like monitoring systems would be clamoring to get that because of all, and it's practically sells itself when you tell the right story.
Well, and when you think about it, that technology in particular, if you're, the first thing that they're targeting is ICUs. These are the sickest of the sickest patients.
Oh, yeah.
And what does everybody tell you when you're not feeling well? You need rest, right? So
yeah,
with the flu, I need rest. It's impossible to get that rest when there's constant noise and constant beeping and constant alarms going off around you. And then on the provider side, I've actually had nurses report that they go home and they hear those alarms in their sleep and they can't get a good night's sleep because they dream about them constantly. And it's one of those things that has been a problem for years ongoing. And their technology allows you to transparently use the AI to dial those in a better way. In other words, it looks at all of these different parameters and says, hey, clinician A, you can adjust these alarms, and here's all the reasons that you can adjust these settings. So it's a very nice technology. I'm excited about them as a company, but I also am excited about them as a potential patient one of these days. I don't want to have to be in the hospital and live with what's going on around me.
So yeah, that's one of those, like, I would never thought I love it. I can't even like just put it into words how much I love that. So for a company like a startup that is struggling with reframing their story from the investors to trying to go to the customers, what's kind of like the best way to get started on reframing? What can you recommend people do if they're trying to make this transition the right way?
I'd kind of take a look. I think one thing that's always helpful to do is look and see what other people are doing, what resonates with you and what doesn't. It's going to help you kind of start to think about it. There's another startup called Active Armor. Diana Hall is the CEO and founder of that company. And she makes these 3D printed casts that are breathable, that you can wear in water, that you can swim with. And she's done a really good job of branding even just her LinkedIn posts. Like she'll have a picture of a kid that's swimming with it on, right? That tells us a huge story right there just with that image. Most kids have a cast, they can't go swimming. They can't take a shower without covering it with a bag. It's a pain, they can't scratch themselves. These casts are fitted, specifically to them. It's great technology because nobody's innovated in this space in years. And so she's developed these great custom 3D printed casts for, all of your different appendages that make your life more livable. And her branding is phenomenal. She'll have, a little kid with a quote saying, oh, I still got to keep my soccer season, or whatever that looks like, and you've got a picture of them out there on the soccer field. That's great branding because it tells a story without her ever having to say a word. As a parent or as any human that's ever known anybody with a cast and has dealt with it, you know exactly what it's telling you in the story that it's conveying. So she's not going out trying to get, like, hey, here's why you should invest in me. This is why it matters and why you need my product. And it's a really, really easy thing to see. So I think if you look at other startups and what they've done, especially the ones that are now on the market, maybe they're, still considered a startup, but they've got some sales underneath their belt. Look and see what they're doing, what their marketing messages look like, and which ones resonate with you. And then start to think about those. I think another thing you can do too is, give your message or whatever those marketing messages are and the channels that you're using, put those in front of people that, maybe friends or family, they're not always going to be 100% honest with you, but you can always take it to even people you don't know and say, what do you think of this? Like, if you look at this, do you know what my product is? Do you know what my product does? And I know it gets harder when you start to talk about things that have a lot of deep science to it. If you're talking about like pharmacogenomics, for example, most people don't even know what pharmacogenomics is unless you work in this space, right? But there's easy ways to explain some of this stuff. Pharmacogenomics is basically taking someone's DNA and personalizing medications for them based on their genetic makeup, and there's a group out of South Dakota, a hospital up there that has a great pharmacogenomics program where they dial in medicines specifically for mental health care. And they're helping people who have struggled through issues like maybe I'm struggling with depression and it's taken me 3 months and my medications still aren't right. Well, they can use this technology to dial in the best medication at the best dosing for you. And it can tell a whole new story. So instead of suffering through depression for 3 to 6 months, trying to figure it out, maybe you suffer from it from a couple of weeks. And that's a great story to tell. And there's ways to tell that story without having to splash pharmacogenomics all over everything. So I think, it all boils down to how could a kind of 12-year-old understand what I'm trying to say here? I think that's always a good thing to ask kids. Kids will tell you the honest answer without a lot of sugarcoating. So kids are always a good thing to bounce stuff off of.
Yeah, I think that's a great suggestion that I think a lot of people overlook or don't. If you ask someone who isn't like friends and family, just someone who, especially you mentioned like kids, that can give you the straight answer without any sugarcoating or any kind of tact to the response. To give you straight up is like, hey,
yeah,
I know what you're talking about. Yeah, it might hurt to hear that the first couple of times because you're not used to getting that sort of blunt feedback from people, but it's exactly what you need to hear. Because if you don't hear it now, you're going to hear it in the form of people not buying from you or people not investing.
Exactly.
And you'd much rather hear it and get your feelings a little hurt or your ego slightly bruised than have your company fail because you didn't listen early on. So yeah, it's
exactly. And a lot of companies really discount the value of marketing and storytelling. And it's those companies that I always see that struggle the most. And I never understand it because when you look at any big company in the world, you look at Apple, they're great at marketing and branding. They're the best at it. But even though everyone in the world carries an iPhone for the most part, I mean, there are other competitors for sure. But even though they've have a huge corner on the market, they're still out there marketing and advertising because they have to. They've got to keep that competitive edge. So if a company like Apple or Microsoft or any of these other big behemoths, when you look at healthcare, Johnson & Johnson's got advertisements everywhere. If companies like that are still paying for marketing and advertising, there's a reason, right? And they're figuring out better ways to tell their story. They're bringing in experts to tell their story. It never hurts to have an expert if you can afford one. But even if you can't, devoting the time and attention to this is really critically important, and it can make or break your business. So you have to think about, how do I bring this in? What do I need to do with it? There's a lot of great tools and resources that you can find free online. Now we have AI. There's all kinds of great AI tools that can help you tell your story. I have, sometimes I'll interview people in the medtech community and put that online. And I use, this AI editor that will come and pick out key points and say, hey, this part of your video has a 98% chance of getting noticed because of this, like this point is really well spoken or whatever. And I'll take that video and kind of throw it up there. So there's tools and tricks out there that you can use. And I would just advise everybody to use them as much as they can, because again, it's about getting to that human element and making people care about what it is you're doing.
Absolutely. Well, thank you so much for connecting with me today, Suzy. I hope you enjoyed this episode of the Human Connection podcast. If you'd like to connect with myself or Suzy, check out the links in the show notes. And remember, no matter if your business is B2B or B2C, it's really H to H, human to human. Happy connecting.